8 foods older adults should avoid eating. Food plays a central role in our lives, not just for sustenance but also for enjoyment and social connection. From family gatherings to special occasions, sharing a meal is often a significant part of our most cherished moments. As we age, however, our dietary needs evolve, and so should our food choices. While you may already know the importance of eating a balanced diet as you age, there are certain foods that should be consumed with caution or avoided entirely. These foods can pose risks to your health, especially if you have certain chronic conditions or are taking medications. By being mindful of what you eat, you can improve your overall health and well-being. Here are 8 foods older adults should consider avoiding. 1. Raw or undercooked eggs, meat, and poultry. Eating raw or undercooked foods like eggs, meat, poultry, and even sushi can put you at risk for foodborne illnesses, including Salmonella and E. coli. While anyone can suffer from food poisoning, older adults are particularly vulnerable due to weakened immune systems. These infections can lead to serious complications, including sepsis, which is a potentially life-threatening condition. Always ensure that meats are fully cooked and that eggs are prepared in a way that eliminates any risk of contamination. 2. Grapefruit. Grapefruit may seem like a healthy snack, but it can interfere with certain medications commonly prescribed to older adults. For example, if you are taking medications for high blood pressure, anxiety, or high cholesterol, grapefruit can increase the potency of these drugs, potentially causing dangerous side effects. It is always important to check with your healthcare provider or pharmacist about food and medication interactions before consuming grapefruit or its juice. 3. High-sodium foods. Too much salt can contribute to high blood pressure, a condition that affects many older adults. Excessive sodium intake can also lead to kidney damage and increase the risk of heart disease and stroke. Processed and packaged foods, such as canned soups, frozen dinners, and snacks, are often loaded with sodium. If you're watching your salt intake, try seasoning your food with herbs and spices instead of salt. The National Academies of Sciences recommend that adults over the age of 71 limit their sodium intake to no more than 1.2 grams per day. 4. Caffeine. Caffeine may help you feel more awake, but it can also cause problems as you get older. For one, it can interfere with your ability to fall asleep and disrupt your circadian rhythm, leading to poor quality sleep. Additionally, caffeine can cause an increase in heart rate and raise blood pressure, both of which can be dangerous for those with heart conditions. It's not just coffee that contains caffeine. Many teas, sodas, and even some medications can have stimulating effects. Moderation is key when it comes to caffeine intake, especially if you have health concerns. 5. Sodas and sugary drinks. Soda may be a refreshing choice when you're thirsty, but it's not doing your health any favors. A typical 12-ounce can of cola contains up to 39 grams of sugar, nearly 10 teaspoons. Drinking sugary beverages regularly can contribute to weight gain, elevate blood sugar levels, and increase the risk of developing type 2 diabetes. If you're concerned about your blood sugar or waistline, try drinking water, herbal teas, or sparkling water instead of soda. 6. Sugar-free drinks. You may think that sugar-free drinks, like diet sodas, are a better option, but they may not be as healthy as they seem. Artificial sweeteners found in these drinks, such as aspartame or sucralose, can interfere with your metabolism and have been linked to weight gain, poor gut health, and even an increased risk of developing certain chronic conditions. Although these drinks are low in calories, they can still leave you craving more sweet foods and drinks, leading to overeating and unhealthy habits. 7. Alcoholic beverages. While a glass of wine with dinner may be a pleasant ritual, excessive alcohol consumption can be harmful, especially for older adults. Alcohol can interact with medications, impair judgment, and increase the risk of falls and accidents. For individuals with conditions like diabetes, liver disease, or heart problems, alcohol can exacerbate health issues. Even moderate drinking can negatively impact your health, so it's important to consult with your doctor about whether it's safe for you to drink alcohol, and in what amounts. 8. Foods with empty calories. Foods that are high in unhealthy fats, refined sugars, and low in nutritional value may satisfy hunger in the short term, but they don't provide the essential nutrients your body needs as you age. Donuts, fried foods, and sugary baked goods are examples of foods with empty calories that don't offer much in the way of vitamins, minerals, or fiber. As activity levels tend to decrease with age, it becomes harder to burn off these empty calories, which can lead to weight gain and other health problems. Focus on nutrient-dense foods like fruits, vegetables, whole grains, and lean proteins to nourish your body. Conclusion: as you age, your dietary needs and preferences may change, but maintaining a healthy, balanced diet is always important. By avoiding certain foods like raw or undercooked meats, grapefruit, high-sodium items, and sugary drinks, you can reduce the risk of health complications and support your long-term well-being. Always consult with your healthcare provider before making significant changes to your diet, and make sure to choose foods that will nourish your body and help you feel your best in your later years. Healthy eating is a lifelong habit, and it's never too late to start making better choices for your health.